Okay, the vagus nerve and diabetes, how the brain affects glucose levels. I am Dr. Martin Rutherford. I am a certified functional medicine practitioner. I'm a chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
And today we're going to talk about the brain and blood sugar, which is a topic that I think is maybe not as well explored as it needs to be. I'll do a little background on this. When we first got together, I was basically doing functional medicine, and I was I'll put maybe slightly more than dabbling in brain rehab, doing some general brain rehab work. But primarily the focus of the practice was functional medicine, altering function with diet, herbs, botanicals, things of that nature. Sometimes even working with the medical community in certain things. Then Doug Gates and I formed a partnership, and Dr. Gates's discipline is functional neurology, in which their discipline, I think at the time it's fair to say, largely focused on functional firing of the brain, not so much on the nutritional aspect of it and things of that nature. As we got together, though, we realized that both were needed. I had another colleague who was already doing both, but not so seriously. And so we realized both were needed, and we played back and forth for a long time. Who comes in, we would evaluate with a full examination. Who does brain work? Who's going to do? Who needs just the brain work? Because that was Carrick's model, and Dr. Carrick deserves a tremendous amount of acknowledgement for his work in developing. If you've heard about brain rehab exercises, it probably came from this gentleman, Dr. Carrick. And but he did tremendous amount of work with that, but it was mainly the brain rehab work. Then, okay, well, this one sounds like it's more metabolic. So we would do one, we would do the other, see what happened. Then we started realizing one affected the other, each affected the other, and we started doing that. And we still were kind of morphed more, I think, in the direction of doing primarily the metabolic work, and then kind of, understanding that doing the brain work was helpful. And then as we meet every Saturday morning, one day, we kind of said, you know what? I said, because he already figured it out or knew it. It's the brain. The brain is just, for years I did lectures that the brain controlled everything. Apparently I forgot that, thanks to one of my many concussions, I'm sure. And so we kind of morphed back into the brain, and that's when our success rate and everything really started going up. And we started realizing that the brain was really the center of everything. Well, who would think that the brain that stress hormones from the brain would be the center of obesity? Or who would think it would be the center of chronic urinary tract infections, or chronic cystitis, or chronic low testosterone, for all the people who are out there taking low testosterone? But blood sugar is something that is now one of the number one things that everybody's talking about in the United States of America. Now we're going to go after chronic pain. So because the medical model knows diabetes, we're going after diabetes. That's going to cure everything, okay? And not making fun of it. I mean, it'll help. Trust me, it'll help if we take care of diabetes. But before you get to diabetes, you have something called pre-diabetes. And I've seen a ton of people come in here with pre-diabetes that is not able to be controlled. With medications. They're doing medications, they're doing their diet, and their numbers are still high, and even diabetes. But we see a ton of that, and so I'll generally share with them. There's a couple of reasons that could be happening. We're going to talk about one of those reasons today. We're going to talk about today. There goes my New Jersey. We're from Reno, Nevada, but I'm still talking like I'm from New Jersey here. So one of the reasons is the brain. And one of the reasons, and it's significant, this is really significant. Dr. Gates has some really valuable information to share with you, not just about the brain's role along with your pancreas, along with your adrenal glands, along with your liver in controlling your blood sugar, but some landmine that you might want to avoid in the future if you really understand what's going on, how the brain through the vagus nerve affects your blood sugar, what's being planned for it, and ultimately maybe some thoughts on how you can address the things that he's going to talk about. So we're going to talk about the vagus nerve and insulin resistance. And from here on out, I'm going to much be all ears, because some of this is new data. And it's going to be new data to me, so I'm going to be listening along with you.
And we've done other broadcasts on diabetes, pre-diabetes, metabolic syndrome. It may help to go back and watch those. I'll just try to go through some basics of blood sugar regulation. When going through biochemistry, the thing that helped me the most understand it is that we have the well-fed state. Think of Thanksgiving dinner, if you celebrate that, or versus the fasting state. So think of the guy out in the desert who's not eating for 30 days and only drinking water. With those juxtapositions of physiology, when we're in the well-fed state, what we want to do is take in all that food, all those nutrients. We secrete a lot of insulin in those circumstances in order to take the carbohydrates from our meal, so we can store those carbohydrates in our liver, so that if you don't eat again for 24 hours, you have a lot of carbohydrate in your liver to keep your brain alive. And during that time period of the well-fed state, there's a lot of insulin to grow muscle tissue and things of that nature. Compare and contrast that with the fasting state. So when you're fasting, we're going to try and take that glucose out of the liver and get it into circulation, get it into the brain. And once we run out of that glucose, then we're going to start metabolizing fats, in essence. You're going to pull fats from your fatty tissue and other tissues. Eventually, you may break down muscle tissue in order to keep your brain alive and functioning during these circumstances. Generally, cortisol mediates, and cortisol and adrenaline mediate this fasting state, and insulin mediates this well-fed state. The problem in our country is that the statistics vary, but a lot of people are estimating that by 2032 or 2050, that a third of the population is going to be completely obese and a third of the population is going to be overweight. And so we have these...
Just heard that 2 days ago.
Okay. Demonstrative issues in terms of body mass. And these issues of body mass lots of times are reflected in disorders of blood sugar dysregulation. They kind of go hand in hand. Not hand in hand, but pretty close. So with that, we have a society that's basically becoming bigger, more insulinogenic. As Dr. Rutherford said, a lot of you are in the pre-diabetic state and having trouble controlling it, because lots of times as people's body weights go up, they become pre-diabetic. They have a 10 to 20 year window of making more insulin before they finally burn out their body's ability to make enough insulin, given the insulin resistance, to where they become diabetic. And then once you become diabetic, you may be put on medications that either help your pancreas to make a little more insulin, or medications that actually slow down the liver's production of glucose so that your glucose numbers are not as high throughout the day. So that's kind of the basic setting that we're working from. Also, I will interject that you probably want to go back and watch our broadcast on prediabetes, metabolic syndrome, and the gut, because in that broadcast, we talk a lot about how these issues of insulin resistance are not just a matter of taking in too many calories. There is a large gut bacterial component that's now been demonstrated in the literature, where pieces of bacteria are absorbing into the bloodstream, like dandelion flowers blowing in the breeze. Just to pause there, you have gut bacteria. For the most part, these gut bacteria should stay in the pipe of your intestines and your colon. They shouldn't be crop dusting your bloodstream. What they're finding is that in pre-diabetics, metabolic syndrome patients, diabetics, is that we get this crop dusting effect of pieces of bacteria that then promote insulin resistance. Very, very important point. So now we know that those with insulin resistance have a tendency for their blood sugar to be a little too high. You have to make more insulin to get the same effect. If you're diabetic, we're trying to slow down the liver's release of glucose. And the new studies are now looking at, well, there's this link between the vagus nerve and blood sugar. So the vagus nerve is called the vagus nerve because it's the wanderer. It wanders throughout your intestines. It innervates most of your intestinal contents, the proximal 2/3 of your small intestine and large intestine as well. So your small intestine, I believe your proximal 2/3 of your large intestine, innervates a lot of stuff in your abdominal contents. And the vagus nerve triggers, or really is the relay messenger of rest and digest responses. So think of you after Thanksgiving. You have a lot of vagal activity going on. And if you want the opposite of that, think of you when you're just in a car accident and you're yelling at somebody because they rear-ended you. Then you're in that fight-flight state. But researchers are finding that this vagal nerve activity helps to slow down the liver's production of glucose, which can be really beneficial for diabetic. Yeah, so it may have like a medication-like effect. So they're doing a lot of research studies on animals right now. The reason why we're bringing this up, because probably in the next few years, you're going to start seeing research studies on human beings doing this, where they're going to try and see if they can replicate what they're finding in animals. And that if they stimulate the vagus nerve with electricity, basically, and specifically it has to be vagal nerve stimulation going to the liver, because the vagus nerve carries information from your gut to your brain and also information from your brain to your gut. So if they stimulate the vagus nerve going to the liver, they can help control release of glucose from the liver, which is a rather novel finding. It's not completely novel. They started looking at this in the early 2000s. There's a big article that came out in the journal Nature, which is a pretty big journal. And then other people have been following up on it. Now, as they've delved deeper into the research, they're finding that with insulin resistance, we've largely thought that it's a problem of the liver. The insulin resistance is in the liver, it's in your muscle tissue. They're now finding that there's insulin resistance in the brain as well, particularly involving the hypothalamus. The hypothalamus is kind of your thermostat for a number of bodily functions between coordinating circadian rhythms, involvement in hormone production. And here it has a direct effect involving glucose homeostasis, as it's termed, so your blood sugar. And they're finding that the hypothalamus secretes certain chemicals and has other hardwired actions down to the command center, so to speak, for the vagus nerve. It's called the dorsal vagal complex. The dorsal motor nucleus is in there. All these other nuclei, nucleus tractus solitarius. You don't need to know that, but just think of the command center for the vagus nerve. And so they're finding that the hypothalamus to the vagus nerve has this big connection, and your hypothalamus can develop insulin resistance, therefore negatively affecting how the vagus nerve from the lower brainstem is controlling how your liver is releasing glucose. So the point that we took away from this is that we see a lot of patients who have chronic illness, who have chronic pain, who tend to be in this chronic fight-flight state. They're not in a nice balance of fight and flight versus rest and digest. They seem to be largely in fight-flight. And we have a lot of diabetic and pre-diabetic patients where their fasting glucose numbers tend to be actually their worst numbers of the day, and they tend to be a little bit better throughout the day. And possibly what's going on is that is the time of the day when your cortisol is going to be the highest. And what I've seen in these individuals is that these are the ones who tend to be the most stressed out. Stress is a bad word, as Dr. Rutherford frequently will go into, because a lot of people will say, I'm not stressed. I'm not stressed. And they don't even realize that their physiology has shifted in terms of this balance more towards this fight-flight state. One of my mentors said it perfectly. When you look at the lifestyle of the average American, between waking up late, drinking your coffee, not eating breakfast, those are all recipes for increasing your fight-flight state and your cortisol and adrenaline levels. And then they're rushing to work. And then it's rush, rush, rush at work until they finally eat something at lunch. They probably eat too much. They get a little bit tired because they're insulin resistant, because they ate too many carbs with their lunchtime meal, and then they have to drink more coffee in the afternoon to keep them going. They rush, 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 go home, stay up way too late on the internet or watching TV, and don't get enough sleep, and then they wake up and they do the same pattern all over again.
And this was our clinical breakthrough. When I said that we switched to realizing that it was really the brain that was controlling everything. But more than that, we understood up until that point in time that our patients were stressed. But then we really understood at that point in time that our patients really weren't particularly always stressed, that their brain was in a chronic fight-flight syndrome, and that they followed a lifestyle like that, and that they they have symptoms of, I can't go to sleep, I wake up, I can't fall back to sleep. They might be, getting anxiety, life is too overwhelming for them, stuff like that. We realized they were in fight-flight syndrome, which is a whole different thing, flooding their system with all kinds of stress hormones, not just the ones that Dr. Gates is talking about right now. And that was our big breakthrough. And then that's a whole nother talk that we've done on how emotional trauma from childhood and from huge emotional traumas in your life create this fight-flight mechanism. And this is just one of the many things that it sabotages. But this is when people come to us and they say, I've been to a good practitioner, I've been to a good alternative practitioner, naturopath, homeopath, osteopath. They've done everything they can. They cannot get my blood sugar under control. First thing I'm going to think of is this. I'm going to think of, okay, they really either didn't know to go after your fight flight mechanism, or they tried to with maybe some simple herbs or something. And this mechanism is has far too much force, far too much power to be overtaken by simply just taking what's called like an adaptocrine or something like that.
Mm-hmm.
So this mechanism, it's not surprising that it would have play a huge role in blood sugar regulation.
Exactly. And so now it just raises the point of, so you're going to see these studies come out where they're going to try doing vagal nerve stimulation for people with diabetes that are unresponsive. And when we're saying diabetes, we're referring to diabetes type 2 for the most part. And so they're going to be doing these vagal nerve stimulators, I anticipate. And really the takeaway from this is you may just want to take a step back and say, okay, I want to look at my lifestyle. I should maybe assess, what was my upbringing like? Do I have issues from childhood? Which sounds cheesy, but trust me, with the confidentiality of a history and exam kind of setting, it's amazing what comes out.
It's stunning
for most people that we run into. And so critically examining, okay, well, what happened in childhood? How much of that is your story? How much of that, not even your story, but do you think about it? Do you have a tendency towards not sleeping well? Do you have a tendency towards being fatigued? Do you have a tendency towards some mild anxiety or mild or severe depression? Do you have irritable bowel syndrome? Are you perfectionist? These are things that you really want to look at, because if you do have components of that, there's a good possibility that you have too high of a firing of this fight-flight response. And just know that not only will that adjust your hormones through cortisol levels and adrenaline levels, but it can also tip the scales in terms of your parasympathetic vagal nerve activation to your gut, which goes back, I'm going to deviate off course a little bit, but that is what chiropractors have been talking about since the early 1900s, when chiropractors were very sophisticated. Chiropractors were the first ones to take a spinal x-ray in North America. So even though our profession may go in different directions, this is kind of part and parcel to the chiropractic philosophy, and which is now the functional medicine philosophy, which is now kind of the alternative medicine philosophy. Needless to say, your brain's firing pattern relative to blood sugar control is important. And that's why we focus on looking at the structures in the brain that may be allowing these fight-flight responses to escape. Basically, it usually boils down to a bad frontal lobe or an imbalance between the memory area and the fear area. And that can be highly important in our experience in addressing things like blood sugar control. It just wasn't until last night that I really saw the concrete data on where this is going. So there's more details, there's more exciting stuff regarding glutathione levels now, and insulin sensitivity, nitric oxide levels and insulin sensitivity, kind of exciting. Those are modalities we've used to help people with inflammation and autoimmune issues and diabetes. But there's growing evidence now that a lot of people can't make this very powerful antioxidant glutathione, or it gets utilized too rapidly when they have this pro-inflammatory diabetic state. That's kind of off the rails, but the main point is, again, what we said. So pay attention to your brain, pay attention to your stress levels, pay attention to this fight-flight response when it comes to controlling your blood sugar if it can't be controlled.
Yeah, and if you're out there saying, well, I'm not stressed, maybe I'm a little confused, I'm not stressed. I have people who come in here who are massively in fight-flight. Their feet are freezing, you shake their hand, it's clammy, you look at their eyes are fluttering. These are all neurological and physiological signs that even though that person's life might be great right now, and they might be in a wonderful state, that their brain is still replaying that emotional, maybe it's a verbal, maybe it's a physical, maybe it's a sexual trauma, maybe it's a massive divorce, maybe their husband died shortly. They're out of that. They're in this state today. They're feeling wonderful, but their brain is still replaying that. And even though they're wonderful, they're exhibiting physical signs that their brain is in fight flight. And if you're someone who has prediabetes or diabetes type 2, and you're having trouble controlling it through the medications, and you have these signs, trust me, it's almost certainty that this is the reason, or at the very least, it's a certainty that it's a contributor to your inability to be able to control that issue. So I think it kind of covers it.
I think it does.
Okay.
Yeah. So if you want the research articles from today's broadcast, you can access those on powerhealthtalk.com. We hope you found this helpful. If you want us to explore this topic in greater detail, let us know. But we feel like we did it pretty well. So we'll see you next week for another exciting topic, and have a good one.